Jonathan.
How are you, sir?
Good, sir. Thank you. John Day is calling.
Okay, good.
Yeah.
It was 11, then it went down to 10. Because of that
Yeah.
mismatch.
All right, you guys ready?
Because it's
Good afternoon, this is Julie Murphy. I'm Flagler County Public Information Officer, and I would like to introduce our Emergency Management Director, Jonathan Lord, to the left, and our Florida Health Department Flagler Administrator, Bob Schneider, to the right. Good afternoon. We'll start with Jonathan because I think he's got some other things on his schedule today. Then we'll finish up with Mr. Bob.
Thank you, Julie. As she mentioned, I'm the Emergency Management Director for Flagler County, and I really wanted to take this opportunity to stress to everybody watching and all of our residents and visitors that in order for us all to help slow the spread of the coronavirus and the COVID-19 disease, that we really need everybody to follow the social distancing guidelines. We want people to stay in groups of less than 10, and if you are out and about, that you stay at least 6 feet away from other people. Additionally, we strongly urge you all to follow the governor's guidance that was put out recently about if you're 65 or older, that you stay at home unless you truly need to go out and about and go shopping for your essentials and things like that, but that we really recommend that those people that meet that age criteria or have weakened immune systems, that you stay at home as much as feasibly possible. Staying at home doesn't necessarily mean you're locked in your house. I mean, you can still walk around your neighborhood, you can go still sit on your patios, but just please, when you are out and about, just stay 6 feet away from anybody else. We also have some other restrictions in place. The state of Florida has implemented restrictions as it relates to restaurants and bars and gymnasiums, where the gyms have to be closed with certain exceptions, where restaurants can only serve food via takeout and delivery, and then those bars that only serve alcohol for greater than 50% of their income, they were actually told to stop serving that alcohol.
And we had a question. So what about people like restaurants that have tables outside? Can they go in and get their food and eat at those tables outside, or is that considering eating at the restaurant?
That is still considered eating at the restaurant. So they can only do pickup or delivery at this point in time.
Right.
There are tons of restaurants in our community that have modified their service delivery to stay open, and I really commend them for being nimble and able to do that. It's very disheartening or sad. I'm very sad that there are some restaurants that haven't been able to stay open in some fashion or another. I feel bad for them and their staff. But unfortunately, in this unique, unprecedented time, this is tough on all of our businesses as well as our residents. But for those that are able to kind of shift gears and offer takeout and new delivery services, we definitely recommend you take a look at, we have a website set up just for that purpose, which is Flagler Open for Biz, and where the 4 is the number 4. So it's Flagler Open, the number 4.biz. We encourage restaurants as well as our residents to take a look at that to see who is open, and restaurants can update their information in that live. The same thing, even non-restaurants are listed on there, so other services that may have modified how they're providing service to the public can use that site as well to update their information. Things with COVID-19 are changing so quickly. Even by the time some of you may see this video, if you're not watching it live and see it tomorrow or a couple hours from now, some of the rules may be different, so we definitely ask you to constantly pay attention to social media. That is the quickest way for us to get messages out, and also keep an eye on our webpage, which is www.flaglercounty.org, and you'll see links on that page to the latest COVID-19 information. And it just is constantly changing so much. Again, only follow, when it comes to public health advice, only follow the official advice from the U.S. Centers for Disease Control, or CDC as it's more commonly known, or the Florida Health Department. Please follow that guidance. There is a lot of misinformation out there about what people should and shouldn't be doing. There are people actually making themselves sicker by following some of this stuff that's visible on social media and on the internet. Please, we beg of you, follow the CDC and Florida health guidance. Thank you.
Is that all that you had to say? Can we move on to Mr. Bob?
Yes.
Okay, Bob Schneider,
Sorry, thank
take it
you.
away.
All right, Jonathan, thank you. I want to let everyone know how much the Florida Department of Health here in Flagler really appreciates and values our partnership with Jonathan Lord and you, Julie, and you, BP, and your entire team here. We are working in unison, we are working together, and we've done so since the beginning. So, the first message is, I want to call to your attention this graphic behind me here. You are not going to believe the wonderful data and numbers and information and guidelines that are available at www.floridahealth.gov. The reason why it's important is because all of the information about total positive cases in the state, cases by county, including persons under investigation by county, including number of positive and negative tests by county, and positive cases by city, all can be accessed through this website. And this is what the graphic looks like. You have the map of the state of Florida. In Flagler County, it shows that we have right now total positive cases of 11, and that includes 10 Flagler County residents and 1 non-resident who is in our community. Of the 11 cases, 1 individual is hospitalized. You see the total cases there at 2,765, and before I came over to be with Julie and BP and Jonathan, I did a double check, and total Florida cases are really 2,900. It's just that the graphic has not kept up with the most recent information from our, what we call our epidemiology surveillance system. It's called Merlin, and that is what we use to tabulate all of these numbers, again, by county, by city, and statewide. Currently, we have 116 persons under investigation in Flagler County. Of the 116, so these are individuals who have had a test, they met the test criteria. 105 of the 116 tested negative. So the remaining number is the number of those that have tested positive. The majority of positives for Flagler County and all the other counties are close contacts within a household of a person that tested positive. So, for example, close contact would be a son, a daughter, a spouse, and someone that a positive case has intimate relations with. So that is an important point, because your Department of Health right now, we are totally focused and dedicated on monitoring those individuals who are persons under investigation, staying in close contact with those who have tested positive. And by the way, the majority of the individuals who test positive, they are at home under the 14-day mandatory isolation, and they are doing well. They are recovering, because 80% of the folks that get the virus, they have mild symptoms, and there's even a percentage who are what we call asymptomatic. They don't have the symptoms in that 80% category. So our team of public health nurses, disease investigators, we're answering the phone. We are monitoring those individuals who are home under self and home isolation. We are staying in very close contact with the individuals who tested positive. And once we have a case that is tested positive, we initiate an epidemiological investigation. And you may have heard this term because we talked about it a lot this week. It's called contact tracing. So what happens is our public health nurses, once they have a positive case, we interview that person. And we try to get a handle as to who have you been in close contact with over the last few days. And what I mean by close contact is this. This would be someone who has been within 6 feet of an infected COVID-19 patient, who within 6 feet for an extended, prolonged period of time, at the minimum, at least 30 minutes or greater. So it makes sense that that would be your spouse, that would be a son or a daughter, or another example would be someone, you're a caregiver, and you're taking care of someone at home who maybe is elderly and needs home support from you, and as a caregiver, you'd be in close proximity, for a prolonged period of time. So it doesn't include, let's say, a coworker whose cubicle is many, many feet away and you say hi to that person, there's no risk there at all. Or if you're in the same building with someone who is tested positive, just because you're in the same building or the same large or small space, that you are of low risk in getting the virus. But we know it's out there because we haven't done en masse testing of everyone in the community. So we know that there's community spread, and so we have to act like, there are people who we come in contact with that possibly have the virus. So that's why our guideline is, if you have the symptoms of shortness of breath, cough, or fever of at least 100.4, you need to first self-isolate, stay at home. Then you need to contact your primary care physician or the Department of Health, or go to an urgent care center to get evaluated to see if you meet the criteria to be tested. So right now we're triaging the diagnostic testing endeavor and effort here, because you've all read about and know that we have a shortage of testing capacity around the country, and you know that there's a shortage of reagents, and you've heard that there's a shortage of test collection kits to get a sample, in this case a nasal swab sample. I'm happy to report that this issue of shortages, including PPE equipment and supplies, that's personal protective equipment, gown, gloves, mask, for our staff to do the testing and staff at the hospital to do the testing, that's required. There's a shortage of that, but it's being addressed by our federal and state government, and we see evidence of that. Supplies are being distributed to all the counties, especially the ones hard hit in the state of Florida, throughout the day, and progress is being made. So until we get to the point of en masse testing for a lot of people, that's called surveillance testing, we have to make sure that the most vulnerable are the ones who are getting tested. So let's review once more the criteria to be tested. Number one, an individual has to show the symptoms of lower respiratory disease. In this case, the cough, the shortness of breath, and the fever of at least 100.4. So in addition to the clinical symptoms, persons who have had a close contact with a laboratory-confirmed COVID-19 case should be tested, and you meet the criteria. Another criteria, and I'm just going to go list them. There's another 5. So clinical symptoms plus persons hospitalized with acute respiratory illness of unknown origin, history of travel to or from an affected geographic area with widespread community transmission, so not only foreign countries, but that would be state of New York, Connecticut, New Jersey, state of Washington. So we've heard about those places in the news. Next, someone who has a history of international travel or cruising. And then individuals over the age of 65 with chronic health conditions, or individuals who have immunocompromised conditions. So those two are the most vulnerable. So people in our nursing homes, long-term care facilities, assisted living facilities, and our elderly who have underlying conditions like congestive heart failure, COPD, diabetes. Those are examples. Heart disease, lung disease, those are the individuals that are most vulnerable and high risk. So if they have the clinical symptoms, they will get tested. So our staff, our public health nurses, staff in doctors' offices, urgent care centers like MediQuick, the Azalea Health, the federally qualified health center there on the Parkway, the hospital, all of us medical health care providers, we are aware of what the testing criteria happens to be. So again, you got those clinical symptoms, contact your health care provider or the health department or these other places. So keep in mind, everyone, that there's no vaccine or medication for this virus. So here's our strong recommendation that applies to everyone. You know, regardless of your politics or your status in life, this is what we want you to do. Again, repeat, if you have those clinical symptoms, we just shared what you need to do. Secondly, stay home. Everyone stay home. Practice social distancing to the extreme. Practice good hygiene. Yeah, that means, yes, rub your hands, scrub and rub for 20 seconds. Okay? Wash your hands. And this is my big thing. When you cough or sneeze, think about it. How many times do people just don't do anything when they cough and sneeze? Or if they do, they sneeze into their hands. We can't do that. We have to change our behavior. So when you cough and sneeze, I want you to do your best impression of Dracula, right? You just get that arm and you go like this and you cough or sneeze into your arm every single time. Next, if you are sick, stay home from work. If you can work from home and telework, talk to your employer. Do it. That's very important under times like this. Avoid unnecessary touching of your eyes, of your nose, and of your mouth, because this virus is droplet transmitted. Droplets in the air when someone coughs or sneezes, and it can land on a table, on a surface, and we've read studies that it'll stay there for 3 days, up to 3 days. So that's why it's important to wash your hands constantly and not touch your nose, your mouth, or your face. And then finally, disinfect all spaces at home and the workplace, especially, again, countertops, doorknobs, door handles, and the like. That is extremely important. You know, Flagler County, we are gonna get through this, but we have to be unified. We gotta use the hammer approach to suppress the spread now. Your medical community, your public health staff, your public health nurses, Advent Health Palm Coast Hospital, our physicians, long-term care staff, law enforcement, EMS, fire rescue, Julie, who's here, BP, Jonathan Lord, and the entire team that's here are working around the clock, dedicated and focused just for you to make sure that we are doing the right thing. Some of us might be risking our lives, you know, when we are out on a call and not knowing if someone is a positive case for the virus. But, you know, our goal is to provide comfort to all of you. You are all important to us, and you have to understand that we have your back. We have all of your backs. And again, we are in this thing together. It's going to be a little rough for a little bit longer. You know, it's hard to predict when all of this is going to go away. But, you know, we know that we're not at the peak yet. We are expecting more cases to surface that are positive because we're doing more testing. We're doing more testing. In our health department, my staff, our nurses, they have been testing all week long, and it's just getting greater and greater, the number of folks that are coming in to see us. But that is okay. That is what we want to happen. So, hang in there, and remember, just as Jonathan said, social distancing right now is the key. There is no medication, there is no vaccine, and this is the one thing that we have in our toolbox. Good luck, everyone, and we look forward to our next update.
Thank you, everybody, for joining us. We really appreciate it. See you next time.